What's nice with going under general anesthesia is that we actually gave you a fair amount of pain medications during the procedure and even before. After the procedure, most over-the-counter pain medications are adequate for pain control for the penile implant. However, should you need something stronger, we will provide that, and that also is just depending on how you're recovering, but that is available. You will not be in a tremendous amount of pain as much as I can prevent it, and so we work to keep you comfortable. To reduce swelling at home, I do have my guys consistently wear a jock strap in the weeks following the surgery, as well as ice the scrotum and the penis in the weeks following the surgery as needed. Immediately after the surgery, I do place a scrotal and penile wrap that's removed typically after about a day or so. When you go home in the following weeks, the jock strap and the ice packs are really what's going to help to keep that swelling down. So for the incision site in general, you will likely have skin glue over the incision, and this will fall off on its own in the weeks following surgery. You typically can't shower for the first 2 days after surgery, and we like to keep that area just like nice and dry. After those 2 days, however, you can shower and just let water and soap run over the incision, but we instruct you not to scrub over the incision and do too much manipulation. Depending on the surgical approach that we use for the insertion of the penile implant, that will dictate on how soon after the surgery you start pulling down on the pump. It can be as soon as a week depending on the approach, so that's something that we will discuss on an individual basis. I recommend a stool softener for all my patients after the insertion of their penile prosthesis. So they're all over the counter. Examples include like Colace. That really helps to minimize the pressure that you're pushing down on, especially in the recovery period. It's important to avoid any undue pressure. So that is something that you will definitely be on after the procedure. Due to the fact that this surgery does involve some work within your abdomen, we really try to minimize any strenuous activity and stress to that area. So I limit my guys to nothing more than 10 to 15 pounds after the surgery for about 2 weeks, and no strenuous activities. And so it's really important for the healing process to avoid that. In terms of bathing, there will be no baths or showers for 2 days after the surgery. And then after that, you can typically shower, allowing soap and water to run over the incision, but not scrubbing over the incision. But no pools, no hot tubs, or anything where you are submerging that incision for at least a few weeks after the surgery. So returning to driving really is patient dependent. You could start driving even a few days after the surgery if you feel like your pain is well controlled and that you're comfortable. You typically cannot drive if you are under the influence of pain medications that contain narcotics. So only if you have something that doesn't have that can you safely drive. In terms of returning to work, it really does depend on your occupation. If you have primarily a desk job or something where you're not doing a lot of moving around, you can return to work, probably close to a week or so after surgery, just giving yourself a few days of recovery. If you have a really kind of labor-intensive physical job, I would prefer that you wait closer to the 2-week period before you return to work. In general, I make myself really available for my patients after the surgery. You can contact me directly, really for any issue that you may have. I'd much rather us have a conversation and have me reassure you rather than have you suffer in silence. Big things I would like you to call me about are fevers, chills, anything pertaining to your incision, such as anything draining from the incision, anything malodorous coming from the incision, any opening of the incision, anything that looks like it may be protruding from, your penis, including like the device, if it looks partly visible or what have you. Any uncontrolled pain that we haven't been able to settle with over-the-counter pain medications or opioids, and also any difficulty or the inability to urinate. Those are all things that you should call me as soon as possible for so that we can problem solve. You can use a device as soon as about 3 to 4 weeks after the procedure. I typically will have you come into the office so that we can what we call cycle the device, and that is really just utilizing the pump, getting it inflated and deflated comfortably. And I'm thinking about it as an exercise. Now that you have this great new device to give you the best directions of your life. We really want to make sure that you feel comfortable using it. And so it becomes almost like a training camp where I have you come back, we're going through this process, and if training camp goes well, the sooner you can use it. If we need to work through the device mechanics a little bit more, it may take you a little bit longer, but most men are using their devices at about 3 to 4 weeks post-procedure. During recovery, you're going to be given all the pertinent numbers to call if you run into any issues. You will be given my office number. I also provide my direct contact number in case you may run into any issues post-operatively. If you have anything emergent at home, such as any of the kind of when to call me issues that I talked about, uncontrolled pain, bleeding, incision issues, fevers, chills, that you just want to go to the emergency room. Certainly if you can't contact anyone, but anything considered an emergency, you really should go to your nearest emergency room, but still reach out.